This is a patient who is presenting with multiple urinary tract infections, and so avoiding cystourethrogram was ordered to be able to evaluate for some kind of cause, maybe due to reflux or some other congenital abnormality. And here we can see the bladder opacifying with contrast. We can also see this rounded or ovoid structure here with a tube running through the middle of it. This is the Foley catheter that is put where we instill the contrast, but we can also see that there are these two other ovoid filling defects within the bladder that need to be accounted for. This patient also had a CT scan that was performed. Here we can see the CT. It was performed on a urographic phase with a split bolus technique. We can see contrast within the collecting systems bilaterally, and we can see that there's some hydronephrosis on the right greater than on the left, with dilatation of the right ureter greater than the left ureter. And as we follow the ureters down, we can see that this one on the right doesn't opacify with as much contrast, whereas the one on the left continues to have contrast within them. And we can see here as they enter into the bladder, this is the bladder outline right here, you can see that there's these outpouchings of the ureters into the bladder. And so these are referred to as ureteroceles. Ureteroceles are cystic dilatations of the distal ureter as it enters into the bladder. Sometimes this is referred to as the cobra head sign because it looks like cobra heads pouching into the bladder. These are more common in females and in pediatric patient populations and can cause urinary tract obstruction or infections. Sometimes these have to be surgically managed. You can do a ureteral implantation, or you can actually lyse the ureterocele and allow it to flow more easily into the bladder. And so this ended up being surgically corrected.